It's a distinct honor to be president of AACC in 2015. One of the major goals that I have during this upcoming year is to see public perception, public awareness of what we do enhanced. And we need to do that in a variety of ways. Any ideas that people have, they should contact the AACC office or contact me. I'm looking for bright ideas and good innovative suggestions as to how to increase the awareness. A couple of ways in addition to advocacy that we can do that is through engaging in the media and trying to be present at public events, developing our contacts at the graduate school level, but even at the collegiate and even in the high school science level, doing more there to inform budding scientists, encouraging them to tell people about clinical chemistry, laboratory medicine as a profession, and that it's a great place to practice and to do good science. The top 3 challenges facing the field of laboratory medicine today, I guess my top would be the perception of the field in the part of the public. In many cases, we are hidden. People don't understand that there are good people in the laboratory working hard to produce the quality, to contribute to patient safety, whether we work for corporate industry, regulatory, or in the traditional place in hospital laboratories. The public and the policymakers, government, don't realize that we even exist. So that's a major challenge, is public perception. Another challenge is meeting the regulations and working with the regulatory community so that the regulations are appropriate and contribute to patient safety and don't inhibit and suppress the quality and the innovation that is available, the engine that's been running this for the last 30 years in the United States and throughout the world. We do not want to see that suppressed, and regulations sometimes have a tendency to do that. So that's another major challenge. And then a third challenge, of course, is cost control. There's definite pressure to all of healthcare throughout the world, really, to manage and control our costs. But the laboratory community, in part because of the thing I mentioned about our public perception, we bear a large burden, much larger than we should, on the cost control. So that's another challenge. AACC can address some of these challenges in the ways that we have done historically through education of our members and laboratory professionals, education on how to interact with clinicians, how to provide value, how to articulate the value that we provide. I think we need to do better, and this is one of my goals as president. We need to do better in advocacy and counseling with the regulatory community and the government policymakers on what it is that we do and what our positions are and why we feel the way that we do and what the needs are so that the government helps us rather than hurts us. We make a difference. Our profession is a great profession. We make a difference. We contribute every day to healthcare and to the patients that we serve. But that word has to get out, and that's one of my major goals.